No matter where you are in the continuum of prostate cancer, its treatment, or the contemplation thereof, I want you to never give up on vitality, never give up on living a full, healthy life. My goal for everybody in my practice and for you all listening is a horizontal lifespan. Feeling great, and then dying quickly. Kind of sad to think about death existentially, but we know it's out there. What most people fear is the infirmity and the withering. So we're talking now about all aspects of vitality, mind, body, spirit, sexual health in particular. Now, for those of you that have already had treatment for the prostate, perhaps the gland was removed, maybe radiation, maybe you had some other type of localized destructive cryotherapy, HIFU, etc. They all have a negative impact, potential adverse effect on sexuality. Men will tell me, I don't feel the same. Something has changed. So the goal is to adapt to the change at the same time trying to overcome it. And there are things you can do regardless of where you are. So I'm going to focus in particular on those of you that have already had treatment with surgery or radiation. Now, you know that I am very skeptical about its value. However, I respect the fact that there is no clarity of pathway forward and that many men will choose to get a prostatectomy or have radiation therapy. It's not the wrong decision as long as you make it with open eyes and with good information all the way around, including absence of fear and urgency. All right, so what can you do to maintain sexual vitality? The first part of that is expect to maintain sexual vitality, with or without erectile function. Of course, you'd prefer to maintain erectile function. So things that men have done, and some of the research can support this. In the preoperative phase, men who were started on daily Tadalafil or Cialis, now in the studies they did 5 milligrams, but in practical treatment, most of the clinicians that are practicing andrology or testosterone therapy, looking at 20 milligrams a day, started preoperatively and continued postoperatively, seem to correlate with better outcome regarding erectile vitality. And Tadalafil and the other PDE5 drugs like Viagra, etc., they don't have any negative effect on the prostate cancer itself. So they're safe to use. As long as your doctor agrees, make sure that you're getting monitored carefully. So that's an important preoperative endeavor or pre-treatment if you're struggling with erections. How about afterward? Now, afterward, if you've had surgery and you're struggling with your erection, it can still be revitalized. I advocate the use of a vacuum. It can be used at the time of sex. So the vacuum can help. Negative pressure engorges the penis. You can use a ring at the base, and now there's some erectile quality. However, it can also be used as part of penile rehabilitation. So postoperatively, you want to keep that penis engorged. You do not want it to suffer disuse atrophy. And even when you're not sexually energized, the libido is down, you still want to keep the anatomy healthy. So I advocate the use of a pump as soon as you can, even if it's been months or years, because there are cases of delayed recovery. So getting the tissue to stay healthy, that's an important detail. The PDE drugs can be of some value, although in many cases, they're just not sufficient. So we've got an anatomical problem. There's been disruption of the nerve and the blood supply. Maybe the erections are just not functioning. Perhaps they never will. We talked before about the value of physical intimacy. Your loved one wants to feel your touch. Whether or not you're getting an erection, do not deprive each other of touch comfort. There are no real supplements that I could recommend that are good unto themselves, but there are some used in complement with these drugs. L-citrulline in particular, L-citrulline is a supplement that is a precursor to nitric oxide. Nitric oxide helps vasodilate. L-citrulline is sometimes described as a supplement, alternative, or complement is a better way to think of it, to drugs like sildenafil. You could take doses of 2,000 up to 6,000. It's also used for folks going to the gym. I take a dose before I hit the gym every morning. Vasodilates, get a little bit better muscle pump. So it can also help at times of sexual activity, a couple hours beforehand. When you're really stuck and you want to revitalize your erection, the Trimix or alprostadil, another option, these are injectable treatments. Now, before you discard the notion, bear in mind the needles are tiny. In fact, I'm going to show you an example of one. The alprostadil is also known as Caverjet. That's a trade name. It's an injectable prescription drug. It goes in the base of the penis. Think of it as local Viagra. It vasodilates, gives an erection. It gives an erection in the absence of foreplay, in the absence of sexual desire. It is a purely mechanical effect. Now, in some cases, feeling the erection happening can enhance libido because now there's a degree of confidence. You don't need foreplay beforehand. You're going into the bedroom not hoping you get an erection, but already starting to feel one. So, folks, here's the needle. You can barely see it. It's about a 31 gauge. These are tuberculin syringes. And the needle typically goes into the base of the penis. So imagine, there we go. Imagine my finger. The needle would go into the base right about there. And you do that about 10 minutes before sexual activity. It works very quickly. It can be prescribed by your doctor. The alprostadil is a standard prescription drug available at most pharmacies. Trimix, on the other hand, is a blend of 3 different vasodilating agents that must be compounded for you. The dose can be varied, which is advantageous because you can adjust it according to the need. So that can restore erectile function. But bear in mind, erectile function is not the be-all, the end-all, the only means of sexual satisfaction. If you have a female partner, she wants clitoral stimulation, man. 15% of women can achieve climax without clitoral stimulation with just penetration. That means the vast majority need that clitoral stimulation, right? So step 1, you got to know your anatomy, boys. You got to find out where the clitoris is. Sometimes you got to talk to your partner. To ask them, am I in the right spot, right? If you are, then you can achieve, a woman can achieve climax. And unlike we men, after a woman has achieved climax, they remain sexually responsive, much more so than men. So if you're contemplating in the bedroom the order of activity, woman's climax comes first. This is not Hollywood, folks. You're not having a mutual climax all the time. That's quite uncommon. But if a man has a climax first, usually that's the end of the game. And that's not very satisfactory to most partners. So bear that in mind. It's okay to do things in sequence. So the Trimix can help with the erections. The L-citrulline, good play. In fact, in some cases, with the guidance of your doc, you can combine these things. They can be used together. The greatest risk is extended period of time with an erection called a priapism. That's pretty uncommon, but it can happen. Blood pressure changes on occasion. But what about the sex drive? Now things are disrupted. Doc, I don't think about sex. I have no desire. That's where the non-hormonal peptides may be of some assistance. There is an FDA-approved drug called Bremelanotide. It's also known as PT141. The PT141, as an FDA-approved drug, it's approved for female sexual arousal disorder. It is an injectable. They do have it as a nasal spray, which I do not recommend. It just doesn't work that well. As an injectable, it can be prescribed by the doc at a conventional pharmacy. And when it's injected, it stimulates the part of the brain where sex drive lives. So it enhances libido, desire. In men, it supports erection and climax. So this can, in some cases, help to stimulate the lost sex drive component that is a missing piece. And that can be effective in cases of post-operative loss of libido or radiation loss. How about those of you that may be on androgen deprivation therapy? Now, you know how much I dislike that for you men, how much I am concerned about it being utilized too quickly. In particular, if you feel great and your PSA is starting to rise, I recommend being very cautious before you allow treatment that blocks testosterone simply to make the number go down. That's a complex reflection unto itself, but take time, get information before you let them castrate you. Horrible things happen. But if you're in a circumstance where you are at a point that such treatment is in your best interest for the sake of symptom control, that's a stage at which I would support androgen deprivation treatment. Bone pain from metastatic disease, right? There's a clear indication of potential benefit. You can safely use these peptides. They don't affect prostate cancer. They do have some potential side effects. In uncommon cases, low blood pressure, sometimes nausea, but properly monitored, it's an option to consider. When injected about 6 hours before sexual activity, sex drive increases, libido increases, erectile potential can enhance. And that can last up to 24 hours. And the PT141 can be used up to 8 times a month. There's another peptide called Bremelanotide, which is similar in its effect. That drug also has more of a skin tanning impact, a little bit less of the sex-enhancing component. But both of these agents can be used, one or the other. Using them in combination is not something I'd recommend unless you have an experienced doctor or nurse practitioner guiding you through it. So we've got you, gentlemen, have an ability to restore sexual activity by virtue of Trimix, oral medications. Don't forget the pump for penile rehabilitation. And Shockwave therapy, low-intensity sound wave, is an FDA-approved device. You want to make sure you get the right kind of equipment. The Shockwave that I'm talking about is an FDA-approved device. That's a distinction because there are lots of different pieces of equipment out there. When applied to the penis, it helps stimulate capillary regeneration, new blood vessels. It helps stimulate the tumescence, the erectile cells, the hydraulics, if you will. It helps those to regenerate. Now, in my experience, I've applied this to men at 3-month intervals. I don't think it needs to be stacked really closely together because it stimulates regeneration, and that takes time. And it takes several months. And if you do it diligently, my experience has been that men tend to acquire, maintain, and preserve sexual vitality with better erections over time. Things that have not worked that well that you'll read about. I've not been that impressed with stem cell injections into the corpus cavernosum. They're expensive. I think the Shockwave is a better play if you're looking at regenerative treatments. I've not been that impressed with platelet-rich plasma or PRP. I think you're better off with Trimix, less expensive, more reliable. So those are a few things that you can consider doing. What it takes, I think, most of all, is an attitude, a spirit, a desire to be creative, a desire to maintain physical sexual intimacy, and a willingness to explore some of these alternatives. Your urologist may or may not be knowledgeable and comfortable with these, but there are docs out there who are. Typically, they operate in the functional medicine space. One other thing I should mention, penile implants. It's an option for those of you that are in a good stage of recovery, good medical health. It is not an option, generally speaking, for folks who've had radiation therapy because there's too much tissue damage. One of the many reasons I don't like radiation therapy, besides the fact that it doesn't work that great, but it leaves lasting, lingering, delayed tissue damage throughout the area. So I've had patients very satisfied with penile implants. You must go to somebody highly proficient. Go to a surgeon who does this all the time, not a doc who does it on occasion. The reservoir is in the scrotum, so that the hydraulic is in the penis itself, and when having foreplay, the penis can be gradually inflated in a very natural manner. So it's really not as mechanical as the old ones used to be, or as it may seem, at least at face value. Other things you should contemplate that'll help your sex drive and erections. Be careful of drugs that you're taking for other reasons. Antidepressants are number one libido and erectile killers. Now, sometimes postoperatively or through the course of this, depression can occur. And drugs like Prozac or like Lexapro or others can be prescribed. They can have value, but they're going to kill, in many cases, sex drive and knock out erection. They can cause fatigue and they can cause weight gain. So as you've become mentally adjusted to your new condition, talk to your doc about coming off of these agents. I like to do that concurrent with the other libido-enhancing endeavors. The drugs that can be used without disrupting sexual vitality, Wellbutrin or bupropion is one to consider, right? I mean, losing sexual vitality can be depressing enough. Adding a drug that makes that more of an issue is not necessarily the best path forward. Well, listen, I hope this has been of help to you guys. Remember, there's always hope. There's always a path forward. There's always a chance at recovery and restoring vitality. Keep looking, keep listening, and always stay positive, guys. We'll talk soon.